Hey, welcome to Elevation Recovery. This is Matt Finch, and in this video, you're going to learn all about the natural SSRI called Kana, a South African succulent plant that modern scientific research suggests that Kana may in fact be a very useful herb. Its active compounds may help with anxiety, depression, to improve mood, and even kill pain. I already knew quite a bit about this Kana plant many years ago after first learning about it. However, I recently read the most epic article about Kana online. It was written by a medical doctor, peer-reviewed by a pharmacist, and the post has more than 62 references and is evidence-based, and I learned way more cool things about this Kana natural anxiolytic, natural antidepressant, and even natural painkiller, which is one of the new things I learned. So I'm really excited to share this with you. Let's get right into it. Kana's most important chemical compounds are alkaloids: mesembrine, mesembrinone, mesembrinol, mesembranol, epimesembranol, and tortuosamine. Of these, mesembrine and mesembrinone are thought to be the most active. Kana has produced positive results in multiple studies investigating these benefits, but larger and more robust studies are required to confirm its effectiveness. Furthermore, some of these studies are at significant risk of bias. Talk to your doctor before using Kana. Mesembrine and complete Sceletium tortuosum extract may work as natural antidepressants. In clinical studies, people who took Sceletium tortuosum as Zembrin, the most common commercially available extract, reported improved sleep and reduced stress. A few psychiatric doctors in South Africa prescribed Kana to patients with depression, mild depression, and anxiety. These reported case studies have been successful. In some cases, patients have responded better to Kana than to conventional antidepressants like citalopram. Kana's mechanism of action appears very similar to many prescription antidepressant and anti-anxiety medications. In cell studies, Kana acts very similarly to medications like Prozac, Zoloft, Zembrin, increasing the amount of serotonin available. In a cell study, a Sceletium tortuosum extract rich in mesembrine decreased the stress hormone cortisol. Researchers suggested that the extract may be useful in people with high stress and high blood pressure. These results have yet to be verified in animal or human studies. Depression and inflammation are closely linked, and some cases of depression may be caused by high levels of inflammatory molecules called cytokines. In one study, cells exposed to Sceletium tortuosum extract increased expression of IL-10, a unique cytokine that lowers inflammation and reduces the expression of other inflammation-promoting cytokines. In this way, Kana protected immune cells and reduced the inflammatory response, which may partially explain its antidepressant properties. However, this effect has yet to be observed in animal or human studies. According to traditional medicine and animal studies, Kana is an effective natural painkiller. In a rat study, mesembrine from Kana was slightly less effective than the strong opioid morphine. High doses of Kana activate opioid receptors in the brain. We naturally produce opioids, endorphins, and enkephalins to soothe feelings of pain and boost sensations of reward and pleasure. Other compounds that bind to opioid receptors include morphine and oxycodone. Unlike these prescription painkillers, Kana does not appear to be addictive. In rats, active compounds of Sceletium tortuosum extract also activated the receptors for GABA, opioids, prostaglandins, and melatonin. GABA calms brain activity and can decrease anxiety. Natural opioids kill pain and create a sense of well-being. Cholecystokinin reduces hunger and prevents inflammation in the gut, and melatonin improves sleep quality. Prostaglandins are complex molecules, but the receptor Sceletium activates EP4 may support gut health and prevent whole body inflammation. High doses of either Sceletium or mesembrine were used to trigger such widespread activation in rats. These effects have not been observed in human trials. Kana is considered relatively safe. No side effects are expected up to a dose of 6 milligrams per kilogram of body weight per day, or 420 milligrams in an average human adult. However, some people may experience nausea when they start to use the herb. According to traditional practitioners, most people get used to Kana after 1 or 2 doses. The safety profile of Kana in pregnant or breastfeeding mothers has not been studied. According to both traditional knowledge and rat studies, Kana is unlikely to be addictive. Rats do not actively seek out the herb like they would seek out an addictive drug. In multiple anecdotal reports, people have suddenly stopped taking Kana with no adverse effects or withdrawal symptoms. And it's for these reasons mentioned that I believe Kana is truly Mother Nature's most epic natural SSRI. Thanks so much for watching. If you have not already, make sure to subscribe and give this video a thumbs up if you got value from it. Thanks so much for watching, and I'll see you next time.